Hi class, my name is Julian McPartland and this is my presentation on MRSA bacterial infection. So what is MRSA? MRSA, or methicillin-resistant Staphylococcus aureus infection, is caused by a type of staph bacteria that has become resistant to antibiotics that we use to treat normal staph infections. For this reason, some refer to it as a superbug. Staphylococcus aureus, or S. aureus for short, is just one of over 30 types of staph, which are a group of bacteria that can cause many types of infections, most commonly skin infections. Why talk about MRSA? MRSA is important to know about because while it does not usually cause a severe infection, older people, individuals with certain health conditions, and those with a weak immune system may be at risk. Looking to the future, experts consider a MRSA infection to be a serious threat, and if it develops further resistance to more antibiotics, it will be even harder to treat and could become an urgent threat. MRSA was discovered in 1961, 1 year after the antibiotic methicillin was introduced for treating S. aureus infections. Since then, MRSA is resistant to all beta-lactam antibiotics. This includes all penicillins and cephalosporins. The first documented outbreak of MRSA in the United States was at a Boston hospital in 1968. Up until 1990, most MRSA infections occurred in people who had contact with healthcare settings such as hospitals. This is referred to as HA-MRSA. Today, however, MRSA infections can be seen in previously healthy people. These people get infections from their community, referred to as CA-MRSA. Let's get more into what HA and CA-MRSA are. HA-MRSA stands for Healthcare-Associated MRSA. HA-MRSA can spread by healthcare workers touching people with unclean hands or people touching unclean surfaces. Many patients in hospitals have breaks in their skin, sometimes from surgical wounds or IVs, and that allows bacteria to enter underlying tissues or the bloodstream. You're at an increased risk for HA-MRSA if you have been hospitalized within the past 3 months, have a weakened immune system, or live in a nursing home. Now CA-MRSA. CA-MRSA stands for Community-Associated MRSA. CA-MRSA is spread by skin-to-skin contact among people in their communities. At-risk groups of people include high school wrestlers, childcare workers, and people who generally live in crowded or unclean conditions. CA-MRSA tends to be less severe to contract than HA-MRSA, as symptoms are more mild skin and soft tissue infections. What does MRSA look like? Under a microscope, MRSA appears as a tiny cluster of bacteria or staph, as seen in this image in the top left. On the skin itself, MRSA infections can appear as small red bumps, pimples, or boils, which may be swollen, tender, or even feel warm to the touch. Often, patients self-diagnosing themselves tend to first think that what they may have is a spider bite, or some sort of other bug bite, as they can look somewhat similar to each other. MRSA can lead to cellulitis as well, an infection of deep layers within the skin. The skin will appear pink or red as if badly sunburned. It may be warm and appear swollen, and often will affect the legs or the arms. How does someone get MRSA? As stated in some points earlier, MRSA mainly spreads through skin-to-skin contact and unclean objects or surfaces, such as shared personal items, clothes, towels, razors, or public railings. Additionally, it can be spread by a cough or a sneeze as well. Even pets can carry MRSA and spread it to you. It can live on areas like your pet's fur, their nose, and their toys. According to experts, 2 in 100 people can carry the bacteria, but may not get infected from it. How is MRSA treated? Community-associated MRSA infections only need to be drained, cleaned, and covered by a doctor. Oral antibiotics can treat MRSA, but MRSA is resistant to many common ones, like of course methicillin, and amoxicillin, penicillin, oxacillin, and cephalosporins. However, healthcare-associated MRSA infections are much more severe and can be life-threatening. Antibiotics are usually required through an IV for long periods of time. The one antibiotic that will almost always work against MRSA currently is vancomycin. How can we avoid or prevent MRSA infection? There are many steps you can take to make sure you can prevent MRSA infection. The best one is to maintain good hygiene. This includes washing your hands and body often, especially after working out. Another great way is to make sure that your scrapes and cuts are always kept covered until healed. This is to prevent any MRSA from invading your bloodstream or deep layers of your skin. You want to avoid sharing personal items such as towels, razors, and unwashed clothes, as these are areas where MRSA can live and easily spread to you as well. To conclude this presentation, methicillin-resistant Staphylococcus aureus infection, or MRSA, is a type of staph which can cause what looks like pimples or boils to appear on the skin that are painful. Community-associated MRSA occurs in young, healthy people who tend to have no recent healthcare exposure and is a mild to moderate skin infection. Healthcare-associated MRSA occurs in people with previous contact with healthcare settings such as hospitals or nursing homes. It can be a much more severe and invasive disease in hospital patients or frequent visitors and can affect bloodstream, lungs, or surgical wounds. The best way to prevent MRSA is simply maintaining good hygiene in your body and hands. The outlook of MRSA is not a good one. Experts do have growing concerns over MRSA and other bacteria as well that have developed resistance to some of our antibiotics, as there are fears that they could someday become either untreatable or extremely difficult to treat. However, over the years, people have become aware of the proper hygiene procedures to take to help prevent getting infected, and the number of cases have been reduced. These are my references, and that concludes my presentation. Thank you, class, for watching, and I'm looking forward to seeing all of yours soon. Thank you.